Okay, so we're going to move on to our next speaker now. So Dr. Ray Nethercott is a consultant paediatrician with a special interest in asthma and is former officer for Ireland for the Royal College of Paediatrics and Child Health. He also chaired the programme reference group and was a board member of the Special Educational Needs and Disabilities Transformation in Northern Ireland. He's a passionate advocate for children and promotes cross-sectoral information sharing as a lever to deliver disruption of the intergenerational transmission of inequalities and deprivation, with the focus on securing professional partnership with developing strong community-based assets. And we're delighted to welcome you here today.
Good morning. Look, thank you all very much. Thank you for the invitation, Elaine. It's a great pleasure and a privilege to be with you here this morning. I don't have quite as many slides as Aoibhinn has, and I'm glad that I dropped a good number of my slides because they actually would have mapped over almost identical to many of the things that Aoibhinn was talking about. You know, my introduction here is as a general paediatrician, so I'm not community-based. I'm not a community health officer. I do work with health visitors or the equivalent of public health nurses in general paediatrics, but these aren't the children that I see on a regular basis. And therefore you're saying, well, why am I up here? Well, I suppose I'm looking at children's trauma more widely, although we're talking about children in congregated settings today. I see in some of the work that I've done in terms of special educational needs and children with disability, that the trauma that exists out there is underplayed and underrepresented. We're looking specifically at congregated settings today, but all of the things that I want to talk about map over to a number of different populations of children. And in some ways, people out there, society in general, think that or believe that children have a good deal in Ireland and Northern Ireland and the UK. I'm more and more coming around to the idea that children don't have a good deal as it's currently set up within the systems and the politics that currently exist in our country and in our countries. And I think that I'm probably speaking to singing to the choir here, but I think much more needs to be done for children, because the consequences of what is emerging and going to happen is going to become very, very difficult to manage. There are no silver bullets. So I want to start and tell you the story of why I'm so interested in this. I got into big trouble with this picture nearly 20 years ago. This is Cian and Shannon. I have their permission to tell their story because it's part of my story. So I'm an adopted dad, and these two came into my life just over 19 years ago, and they were in the care system in Northern Ireland. So they were living in care for nearly 2 years before they came to us, and their parents, so their siblings, and their parents were 15 and 16 when they were born, and their parents were known to social services, and their parents wouldn't accept the help from social services that they need to look after Cian and Shannon's needs. So they got into trouble, and one of the children was hurt quite badly and admitted to hospital, and both children were brought into care. And social services did a huge amount of work with their parents to try and place the children back with their parents, which is right and appropriate. But at that particular time, as a 16, 17-year-old young person, they weren't able to accept the help that was being offered. So Cian and Shannon came into our lives, and we have been incredibly blessed, as much challenged as we have been blessed by them, because we were told by our colleagues in social services, look, these kids are brilliant, they're fantastic, you know, you're going to have a fantastic life. Very quickly became apparent to us. So my wife's a paediatric nurse, and I'm a paediatrician who's been doing the job for even quite a bit of time at this stage. That Kane and Shannon just didn't fit the picture of normal children. They didn't have the ability they were very self-sufficient in and of themselves, but they didn't have the ability to relate to other kids of their own age. They were hypersensitive to noise and environments where there was, just things that they hadn't been exposed to before, and they had a degree of interplay between themselves that was best described as dysfunctional. But my wife and myself were taking this on with, years of knowledge and experience as practicing childcare professionals. But we were completely out of our depth in terms of trying to understand what was the behaviour that they were manifesting and why were they behaving that way. Surely they had, everything that we could provide for them physically, and we were doing the best that we could emotionally and psychologically, but they were not able to cope with the new family environment. It was one of these things that really started to puzzle me and to try and understand exactly, what was going on with them. I had as I said it before, lots of knowledge in this space, but didn't have the same lived experience that they had. And obviously couldn't exactly put myself into their shoes. But I did start to do quite a bit of reading to try and understand where they were at. And this was sort of at the time, probably about 3 or 4 years after they came to us, that adverse childhood experience started to be talked about within the healthcare setting, within social services. And the penny started to drop with me that my family and my kids had horrendous experiences that they weren't able to explain or understand or communicate to me as their dad or to anybody else. But the adverse experience that they had, that Evelyn talked about, it's not about counting the numbers. It's about whether or not there's adequate resilience, and our kids didn't have that resilience at that particular time in their life. And they were living through, and we as a family were living through some of the consequences of that. Understanding why it happened is an impossible ask. Understanding what's going on with them, I was starting to get to grips with it, and bringing them and myself to an understanding of how we could be better parents for them. The long and the short of it is, we're still muddling through. Cian is now 23 and he's a dad. He didn't get to be a dad until he was 21, but we'll talk about intergenerational transmission a little bit. Shannon is almost 22 and she's done her degree in music, and she's a fantastic performer. And they have, to a greater or lesser extent, done a huge amount of their own trauma history and owned it for themselves, because I can't actually live that experience for them. But what I could do in my position as a paediatrician and later within the Royal College of Paediatrics and Child Health is advocate for them and for children like them, and children that we're talking about today, in terms of actually saying we need to do much more for them to be able to ensure that we minimise the impact of what's coming down the line. It's much better, and unfortunately this is quite a male sort of sided quote, but it is of an age. It's much better to build strong children than to repair broken men. We're seeing a huge amount more special educational needs. We've got a huge or a growing population of children in accommodated settings. We've got a very large cohort of kids that are going out there unnoticed in terms of, I don't know, people have had the chance to sit down and think about watching adolescence and the consequences of that. For me, there is no silver bullet. As was highlighted earlier, it does take a community, it does take a village to raise a child. And really, I suppose since the Industrial Revolution, we've actually disinvested ourselves of our village, we've disinvested ourselves of our communities. We've actually got social structures that aren't encouraging them and aren't building them up. And I think that we need to potentially think about ways of addressing that. So I want to talk a little bit about adverse childhood experience and where it came from. Some of you have probably done some of the work on becoming trauma-informed would understand Vincent Folletti and Robert Anda's work with the Centres for Disease, or Communicable Diseases in the States. So they did quite a large epidemiological study looking at nearly 18,000 people within settings that were actually quite like what we have probably in this room, people who are reasonably well educated, who are potentially in full-time employment, who have what we describe as a normal experience. But what they were finding in that population was this adversity that we come across. And they started counting the numbers and looking at, within adults, the types of chronic conditions that those adults were experiencing. And really what they were theorizing was that if you have a large number of ACEs, there is some physiological maldevelopment which leads to social and emotional problems, and then you end up with health-harming behaviours, and that leads to early disease in early adult life and early death. Now, there wasn't a cause and effect in terms of linking the science up in these things, but the association or the connection in terms of statistical probability is that this is probably fairly sound. And this work has been replicated in a number of different environments across the UK, across Europe, and again repeated within the States. Here we go. So Mark Bellis, again, some folk may have come across his work with Public Health Wales, looked at this within the Welsh population. And each of the sort of ACEs that we talk about in terms of physical abuse, verbal abuse, sexual abuse, parental separation, household domestic violence, mental illness, incarceration, drug use. He looked at the breakdown and again was looking at the number of ACEs that people were experiencing and accumulating. And the more ACEs you accumulate, the more likely you are to have that health-harming behaviour. That sort of 14% number, what does that mean for Ireland? I'm not sure that any prevalent studies have been done in in Ireland for ACEs. It's not the number that's important, but actually understanding that at a population level probably is useful. Northern Ireland, it's around about 17%. So it's higher than Wales, which is sort of what we were expecting. And this was a prevalent study that was just published by Queen's earlier this year. And the number of people who had that adversity associated with the armed conflict was something like 1 in 5. So we are dealing within Northern Ireland with a particularly traumatised or a very high burden of ACEs. Now, it's not necessarily so much the ACEs that are important, it's actually about how many resilience and how much resilience factors you have in your life. Now, everybody in this room and lots of other people involved in services and service delivery want to think of themselves as that always stable and available adult. Unfortunately, we're not as stable, just look at me, or as available, because services operate often Monday to Friday, 9 to 5, and not necessarily at weekends or bank holidays. We're not capable of meeting some of that resilience requirement and stability for children to try and counteract or to mitigate the effect of their ACEs. I'll come back to that a little bit later. Now, the ACEs bit, the bit that gets me, and the bit from Mark's work, that was really striking, was that the persistent health-harming lifestyle, drink, drugs, calories, violence, that dopamine response that these people gravitate towards is very, very, much more prevalent in their lives than it is in the rest of the population. Those consequences of out smoking and drinking and beating each other up are well known to our public services, and there's a much higher demand for public services, whether it's the guards of the police getting locked up in prison, being involved in drug taking, involved in gambling, and the health consequences of all those things lead to shorter lives. And unless we can reduce some of this burden of ACEs, mitigate the effects, we are going to see further escalation in demand for public services that are currently stretched, and many services, particularly for children's services, are overwhelmed and can't manage the burden that's coming to them at the minute. So some of the specifics from the Welsh work: 4 times more likely to have type 2 diabetes. Type 2 diabetes, more stroke, more heart attacks, more people that are on drugs long term, more amputations, heart disease, again, in a much younger population, respiratory disease. And all of these ones end up with more likely to see GPs if you can get an appointment with your GP. Certainly Northern Ireland, which is free to service, we can't get appointments with GPs for 2 to 3 weeks. Maybe if you're paying for an appointment, or if you have a medical card, you can get there quicker here. I don't know that you can. If you can't get your GP, you're going to end up going to ED, and the waiting times for EDs, trolley waits are used to be Northern Ireland, they used to say, I'm glad we're not as bad as the South. It's actually flipped now. We're much worse in terms of trolley waits than you guys are. To have stayed in hospital overnight, in terms of, this all costs money out of the public purse. And there's much more likelihood that the population that we're discussing, that we're wanting to advocate for today, is going to end up with these difficulties and problems for the future. But if you try and talk to adult health colleagues, they're very, very protective of their resources. And if you talk to people that are designing services within the HSE, they're going to say, but we've got an elderly population. We've got all of these population pressures coming down the line. I would be saying, look, unless we are looking after the kids of today, your problems are going to be double in a very short space of time. The other thing that is happening with these children and families and the consequences of where they're at is their chances of getting a job that's well paid is much less than most of the rest of us. Their chances of being what's described as economically inactive is much higher. Northern Ireland has an economic inactivity level at the minute of close to 26-27%. So that's more than 1 in 4 of the adult population who aren't working, who aren't seeking work, who are much less likely that they'll never work. And that's chronic disability, it's mental health difficulties, it's special educational needs. That population is growing, and it's going to grow more. I tried to see if I could find figures for the Republic of Ireland. It depends on who you talk to. ASRI talk about it, I think, around 22%. It's about 1 in 5. CSO, from a number of years ago, were saying it's about 17 or 18%. I suspect it's going to grow, that economic inactivity, where people aren't able to make a meaningful contribution to society in a way that we're taxpayers or that we're contributing. Now, that's not to say that these people are not clever. I can tell you from my experience with Cian and Shannon, and experience from talking to other people in the room, most of these young people and kids could buy and sell you. They have a way of working which is outside of our normal systems. They will potentially work very well within the black market, so they're never going to pay tax, but they have a way of working that works for them, but it works for them within the community of who they own and who they understand themselves to be, and their ability to belong to the wider society. They've got significant barriers in terms of that sense of belonging. The same way that young kid in adolescence didn't feel that he belonged. He felt at a distance from his family. He potentially, if you step into his shoes, felt so disempowered and so disenfranchised that he was able to dehumanize another human being to the point of exerting extreme violence on them. And that's potentially not going to be a story. That's potentially going to be a story that's going to be repeatable. And we need to do much, much more to break down the barriers. And again, I say, there isn't a silver bullet to these things. Just by way of an example, I've sort of picked out the suicide figures over from 2015 to 2005 in Northern Ireland. No, let me see. I don't have a click. Does this clicker work? Yeah. So the very dark blue bar, and this is broken down by deprivation, and it's for young men. The blue bar at this far end is the most deprived, and the light blue bar at the far side is the least deprived. And year on year, consistently, there's more young men that are losing their lives from economically deprived backgrounds. Now, they changed the definition around 2005 to exclude people who were choosing to die by choosing their suicide by overdose. So they took some of the overdoses out. But, be very clear that people choose to take their own life by taking overdoses. And now, statistically anomaly, so that would have made the figures look a bit better. But we are losing generations of people that have very significant things to offer society, but they don't feel part of it. They feel so distant that they feel that taking their own life is a much better option than actually partaking within life. We need to find ways of helping them to help themselves, because there's no point in me talking about it, and I could be talking till I'm blue in the face. they're actually going to have to discover that for themselves. And I think it's about facilitating those communities to come together to solution find for themselves, and for them then to come back to services and say what they think will work to services, rather than services saying, here, try this, we think this will work. It sort of turns it on its head a bit, but I think it will shorten the cycle of quality improvement no end. So we need to sort of say, look, yes, we've done all the trauma-informed work. Now let's move on to actually practicing in a way that's going to be much more accessible. We are never going to be able to remove stress from life. Adversity is potentially a threat, but it's also an opportunity. If you can exercise your resilience muscles and build your resilience and find ways to focus on resilience, then potentially we can help individuals to be much better able to help themselves. I think we have to move to being much more protective and much better connected, not just within what you're doing in social inclusion, but also about saying that this needs to be replicated out into special educational needs. This needs to be out into social and domestic violence and abuse. This needs to be out into how we operate and run our prisons. This has to be owned by the whole of society, not society saying, well, look, those people over there, we pay them to do that, or those people there, that's their problem. The way we run government, it's all, I sort of had a fair bit to do with the Department of Health and Department of Education over the last number of years. And whenever I started looking back at, everybody remember Yes Minister and Yes Prime Minister? Yeah, that's a documentary. It's not a comedy. They're constantly playing games about, well, that's such and such's responsibility, or that's got nothing to do with us. Actually, it does have something to do with you. Oh, no. You have to find this department and that department and this subsection of that department. Our government sort of doesn't work in terms of communicating and talking together. And it sort of disempowers us by dividing up the budget in such a way that you're not allowed to use this pot of money for that purpose. We have to get to a point where those folk that we can identify as requiring help will accept help in a way that will work for them. So what do I mean by that? As I said, Cian and Shannon have been through a life experience that, I wouldn't wish on anybody, and none of you would. But they, and Cian in particular, has not been able to access the help and supports that could be made available to him. He's still part of our family. We still love him. He's chosen to live away from us. And we've spent thousands of pounds on counselling for him since he was sort of small in terms of doing family counselling, till he was a teenager and was having lots of disruptive behaviour in school, and even later as a teenager. He was able to run rings around all of his counsellors. He was able to take them to the cleaners because he had a way of thinking that was different from theirs. Now, I'm not saying that was, well, yeah, we could have gone on some very nice holidays, but we didn't. But he hasn't been able to access help that could be available to him because the help was being attached to certain conditions, and that maybe we were putting forward consciously or unconsciously, but some of that has to change in terms of him being able to accept things in a way that's going to work. We need to find a way to invite our small pockets of communities into the bigger identity of Irishness. And some people have done that really, really well. But I worry that we may end up replicating some of the problems that we're seeing in multicultural UK, where we've got pockets of communities that are existing within our society and have become very disconnected to our society and become radicalized and become resentful of their perception that we haven't accepted them or that we're different from them. And I think that that's something, again, that needs to be thought about for the future. We haven't had, up until recent years, a massive influx of those types of communities with the types of adversities that they have. England has big pockets of communities that are very tight-knit, and within some of those communities they do have a radicalisation that potentially Ireland could be at risk of if we continue to, or we don't open ourselves up. The really, for people and for societies, they need to feel that they're felt. They need to be heard and listened to and understood. Evelyn put it very well. You have to give people the space to tell their story. And you have to give them the time to tell their story, because their story is what's precious to them, and it's what counts and what makes them then. And unfortunately, our services are structured and often very time constrained, and we're going to have to, again, find ways to reorganize things to be able to do that well. So you've heard it from 3 speakers so far. It takes a community or a village to raise a child, and I think that we need to rethink about how we put that construct in place, where communities feel that they have permission and the ability to self-support and to speak into one another's lives, rather than potentially sort of pick up the phone and say, well, this is such and such a service's fault, or I'm not going to be part of that. It's not my problem. Western democracies have this population inversion that's happening. So in Northern Ireland, in 2028, which is 3 years away, the number of children under the age of 15 will be equal to the number of retirees 65 and over. And that's only set to get wider. Many Western democracy populations just aren't replacing themselves. So there aren't people to fulfill the roles and the jobs of the future. And if we've got an increasing burden of economic inactivity, who is going to take up the jobs and populate the roles that we all have today and tomorrow, and meet the needs of the older population in terms of providing the services that they need? At the minute, yes, our governments are thinking, what do we do with all the retired people? I would say we need to actually turn that on its head and say, what are we doing for the young so that they will be able to be active participants in society and deliver for our society what it needs in terms of being a caring and inclusive community for the future? Are we going to meet those needs in terms of those service needs by opening up migration to more people coming in? That may be the right thing to do, but these changing demographics are very real, and at the minute most of the pressure on government and politicians is to cater for the service needs of the older and retiring populations. And people my age and older are designing services for my retirement in the not too distant future. I'm not doing that for that, but I'd actually say, look, let's change that. I was interested that Evelyn showed Michael Marmot's sort of change in birth rate with poverty. In England, the child poverty has gone up, and also the child infant mortality has actually gone up a couple of points over the last 5 years. So those things are real. The other interesting thing is Michael Marmot, in terms of the epidemiology that he's done, he's always been working as a geriatrician, and he's actually turned tack now and says we need to be doing some of these things for the younger generations. And if we don't cater for the younger generations, we're going to be in a real predicament. We need to, again, I sort of say, try and move away from victim blaming. We have a media and a general societal attitude that blames others or blames people or is seeking justice in a way that is looking to persecute and prosecute the perpetrators of ill doings. I would be saying I need to be very clear about children and young people that have had adverse childhood experience. They do not have choice. They do not have agency. And some of the consequences of their behaviours are not their choice. So you take things like drinking too much or smoking too much. They all know that they shouldn't do it, but they can't help themselves. Their brain biochemistry is wired differently. That's why they're making the choices that they're making. They don't have the choice. They don't have the agency. We need to find a way of doing that or doing it differently. And we need to sort of call out the media and say, look, you know, you're looking for a blame culture. If we're going to pursue a blame culture, then we're going to almost certainly end up blaming victims more than perpetrators. And the perpetrators often have a story and have a narrative. Not that we're looking to justify what they do, but that narrative and that story needs to be much better understood. And adolescence is a very good example of that, because they've flipped some of the ways of thinking and saying, look, this kid is a victim of a societal construct that has him online, that has him disconnected from his parents, that has him being parented by his peers who actually haven't a clue what they're doing. And no wonder they run down a rabbit hole and become difficult and become much less empathetic and do things that are devastating for them and for other people. But, you know, that issue of violence is the same for kids that are self-harming or kids that are, you know, not eating and have eating disorders. You know, there's a multitude of difficulties that our younger generation are having to navigate. And unfortunately, they're having to navigate that on their own. Last bit, NIMBYism. I'm sure that many people in this room can't necessarily understand why there are pockets within our Irish society that's saying, yes, that sounds like it's a good thing to do, but you're not allowed to do it close to me. I don't want such and such living close to me because that's going to reduce the price of my house or the valuation of my house, or they're going to come, they're going to steal from me, or they're going to... We need, again, to find ways of combating that very actively. And it's not necessarily the responsibility of people in this room to do that. That's going to have to be a much wider social conversation to try and make some of those changes that are necessary happen. So I'll leave you with this comment. We do need to start to understand much better what's going on in the lives of our kids. We do need to understand that and start to do something about it, because we are going to run into lots of difficulty. My biggest worry is that those kids that are very well adapted, that are coming from good homes, that will succeed in the system as it's currently constructed will, one, maintain the status quo so nothing will change, and two, will actually leave and go and try and get better jobs elsewhere and won't actively contribute. So those that can will move, and those that will be left behind will be increasingly dependent on public services. So we need to go upstream. We need to go to these families now and help them find ways of helping themselves so that they can have better outcomes for their children, so that they can have resilience. We're not going to take away their adversity. We're not going to take away all of the stresses that they have in their life. But if we can gift them resilience for and of themselves, they will be able to manage much better. Last word, I'm a granda. I know I don't look that old. Well, I like to think that. So this is Cian's little boy. Cian has got to a point where him and his partner were able to accept help. So he was 21 whenever they had their little baba, and their little baba is actively involved in our lives. We have in Northern Ireland a health visiting programme that looks after mums and babies for the first 2 years of life. So it's slightly different from health visiting. There's a much more intensive support with family nurse partnership that builds a relationship with mums and dads, that takes mums and dads all the way from pre-birth to 2 years of age in terms of their two-year check. That partnership, Cian probably several years before would not have been able to accept that help, but he's got to the point where he has and his partner have accepted the help to look after and to mind Logan, and Logan he's thriving. There's a break, I believe, in the intergenerational transmission for his story, and I would love to see that break in intergenerational transmission of adversity and trauma in many, many, many more lives. I leave it there, and thank you all very much for your patience.